When you and I get a cold, we tend to have a stuffy nose, we might have a temperature, and we might have a slight cough. It gets better in a few days. If a small baby gets a cold, it can go down onto their chest, and we call this bronchiolitis. So they start with the stuffy nose and the runny nose, and then they develop a cough that seems to last sometimes forever, but generally it gets worse for about the first 3 or 4 days. The next 3 or 4 days are when you feel really worried because your baby doesn't seem to be getting better, but that's a normal pattern. And then after that, the baby gets better slowly, though sometimes the cough can be there for up to about 4 weeks. It's usually caused by a virus, so no antibiotic or medicine will help you get better faster. We usually recommend is that you just mind your baby, not too much handling, feed them little amounts and often, and they will get better by themselves. Some babies do need to come into hospital or do need a doctor. Key things to look out for are if you're just worried about your baby, if they're pale, if they look grey, if they look blue or tired or sweaty, if they're not really interested in their surroundings as much as they normally are. If their breathing is very fast, or if they're having episodes where maybe they're even stopping breathing, or if you notice that they haven't had a wet nappy in a while. If you're worried about any of these things, just pop into your doctor or bring them to your local hospital.